Welcome everyone to today's program, which is brought to you by SpineMark. I'm Robert Kurtz, moderator for the webinar. The program will begin with my asking a series of questions to Marcy Rogers of SpineMark, and then we will ask your questions to Marcy during the attendee Q&A portion of the program. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Marcy will attempt to answer as many of your questions as she can during the Q&A. It is now my pleasure to introduce Marcy Rogers. Marcy is President and CEO of SpineMark Clinical Research Organization Management and SpineMark Corporation. SpineMark is the premier global spine service company for the development of spine centers of excellence and spine research organizations. SpineMark works with physicians, hospitals, facility companies, third-party payers, and medical manufacturers in the fields of spine, pain, orthopedic surgery, and neurosurgery. For more than 30 years, Marcy has worked with leading healthcare professionals, facilities, and medical device manufacturers to advance her goals of improving patient outcomes and satisfaction. I want to welcome Marcy into the program and begin our discussion with my first question. Marcy, why has marketing become so important for spine centers and surgeons?
Rob, thank you very much for your nice introduction and your first question. Right now, with the market being as competitive as it is in spine, and with declining reimbursements in spine, as well as negative press surrounding many physicians in the field, as well as the procedures and the efficacy of them itself, it's more and more important that marketing be implemented to help promote effectively the programs for the center, the services for patient care, the credentials and the credibility of the physicians and the allied health team that are involved, and also to be able to become a market mover, if you will, in this highly competitive environment. Right now, insurance companies are looking for data. Data is driving not only referrals to centers, but reimbursement. And overall, they're also looking at the credentials of the physicians, advanced training they've had. So it's really very, very important that as part of a spine center program, to be able to attract the kinds of patients you want to your center, you've got to create a broad-based marketing campaign that touches a number of different segments of the local, regional, and even in some cases national and international community. Specifically, we look at looking at various markets for medical or physician referrals, payer or employer segments of the market, and how to attract referrals from that location. Patients as consumers, as well as consumers broadly in the market, and any unique niches that might want to be attracted. For instance, in some locations, many hospitals and physicians are now looking at differentiating themselves through personal injury cases because there's such a great need, and traditionally the market's kind of looked at them as at the lower base of the market. But because of the needs of these patients, because of the reimbursement, and because of the ability to impact change, these are the kinds of little differentiating markets people are looking towards. Another very unique market is robotic surgery in spine, which is becoming a major attraction for insurance companies as well as hospitals and surgeons who adopt this technology. So the key is to identify the major segments in the market, the insurance companies, the medical referrals, the consumer referrals, and develop strategies towards attracting and building relationships. Marketing is not an event, it's a process.
Transitions really well into my next question. So what needs to actually go into development of this marketing plan?
A marketing plan really needs to become really your pathway or a tool for navigating and setting up your plan. So you want to look at your entire catchment area And usually you want to have around the spine center between 250 and 500,000 lives that could possibly be served by the center. A SWOT analysis, that's your strengths, weaknesses, opportunities, and threats. A plan of activities for each of the segments I previously alluded to. A specific budget identified for marketing and the programs you're going to use, thinking about programs specifically in those target markets I just discussed for medical referrals, payer or third-party payer referrals, employer groups that may be in your area, and then consumer/patient programs. Our focus and what we believe is the most effective is education and developing very specific, customized activities to educate each of the components and the constituents in these target markets. So that needs to be in the plan. And you need short-term and long-term strategy, and last and not least, a timeline and deliverables. Now today, with the advent of social media, it's become very, very important that social media be adopted as a very integral part of keeping in touch and networking with patients, the community, as well as the world. I don't know about anyone else, but I'm getting tweets on a regular basis from places like from Saudi Arabia to Littleton, Colorado, to the Caribbean, Asia, and these are what social media has made this, and the internet has made this giant world a connected one. And so I think it's very important to include in your marketing plan how you're going to use social media and the internet and the strategies it offers to also promote and educate about the services of your spine center.
Let's dig down a little bit further on that. Let's focus on what do spine centers and the surgeons they need to be doing specifically to grow their local and their regional presence.
Well, that's great, Rob. Thank you for helping us dig further. It's very, very important for surgeons in their local area to understand that not only what they believe their reputation is, but to understand perception of, how they feel about them. Because a lot of times there's reasons Dr. Smith stopped sending you patients that are unknown to you. So what we'd like to do is divide up and look at data on a quarterly basis, identifying where are we getting our business, who have we lost, who have we gained, what do we know in terms of feedback. So surveying, if it's possible, your constituents, local area, third-party payer, from employers, from patients, consumers, and identifying their satisfaction, if you will, with the services is very, very important for the growth of your local as well as your regional presence. You also need to be able, yes, I'm sorry, go ahead, Rob.
No, sorry, no, please continue.
Okay. You also need to identify in your local community where are patients going to come from. Are there various industries that are producing a high level of spine-specific type injuries or referrals? What about athletics? Can we connect with those athletic groups that might be candidates for the conservative care as well as the operative, non-operative care of a spine center? And then from the primary care on the medical referral side, who are the lead specialties that potentially grow or send to your practice and the center? And what can we do to strengthen alliances with those groups and offer them an opportunity to be able to streamline their practices in terms of referrals and get the necessary information they need as well. In addition, going back to the education model, very often insurance companies do not know about a new device or a new technique in spine until they suddenly receive a claim and they have to process it. So we believe that a quarterly payer education type of program where you visit key carriers on site, present a presentation on recent advances, work, which usually goes towards either the nurse case managers, the medical directors, sometimes the adjusters, if it's a work-related injury carrier, is very, very effective in growing and building your regional presence. Same thing is true with the third-party claims administrators, particularly in work-related injury, who are the gatekeepers, if you will, with the adjusters for these patients. They want to know who's in the area, what they do, and where they can get the best care. And then last but not least, there's a whole host of consumer types of events that, you know, need to be viewed as an opportunity for education. Health fairs, various sponsored events by different agencies in the community and the local region. These are all conduits for building a center. And once you do it locally, then you start developing a layer of concentric areas out into regional areas, looking at the same type venues. And in addition, looking at the opportunity with local physicians or a local practice of some kind, setting up satellite screening clinics. So you're constantly expanding your circle of referrals as opposed to having a catchment area that is decreasing.
Is that the beginning of what an organization would want to do if they're going to try and then grow a national and international presence?
Absolutely, and it starts as simple with the creation of a travel program that can, you know, for outside your area of patients who want to come to the spine center, and being able to create some concierge type services to support those patients, having some dedicated liaison with the center who can handle, you know, the travel, the medical arrangements, the hotel, the transportation, linking them up with community events. Building that on a regional basis or a tri-state basis is a great lead-in into national and international marketing. One of the most important phenomena that's happened in the last 10 years of our lives is the growth of medical tourism. And now what you're seeing is many, many insurance companies going to third parties as quote-unquote surgical claims administrators, looking to place patients outside of where they may live or where they're going to see their doctors for discounted bundled case rates for spine services. And depending on the proximity of where you are, they usually send a liaison with the patient, and the insurance company or the employer is very, very happy because they get a discount. There are even hospitals in Pennsylvania, for instance, who are building a national program like this in heart and spine surgery that offer a 90-day guarantee post-surgery, that if anything happens, you will not have to pay any additional charges. So look at that as the consumer version, if you will, of healthcare reform, because that is definitely an advance. When you're talking international, again, yes, all of this feeds into it. Depending on the proximity of where you are and your access to the borders or the international access for getting patients from Canada, Europe, wherever you think you might want to market, this foundation needs to be in place before you think about building an international presence. But as surgeons who like to travel to foreign places and teach and educate, it's great to set up a type of pilot program where perhaps the doctors and the team of the Spine Center go every 4 months to an international location where they have a relationship and work with a local hospital or team of doctors to educate and consult and see patients and help the surgeons learn new techniques. All of this is all possible under these types of programs.
Thank you, Marcy. And, next question, you've touched on this a little bit. I'm going to ask you to expand a little bit further. What key markets should spine centers pursue, and what strategic initiatives?
Right now, the most important key markets for spine centers should pursue are definitely on the employer side of the business, as well as directed business from work-related injury carriers. These types of patients, there's 1.8 billion people in musculoskeletal pain in the world. And back pain is the leading cause of disability, not only here in the U.S., but globally. So it's very important to be identifying the markets in your local and regional area that offer you the opportunity, and the groups such as employers in construction, warehousing, transportation, shipping, aviation, those kinds of activities, construction, that lead to a lot of work-related injuries. And then developing affiliations with those employers, maybe offering them on-site pre-placement evaluations of employees who are at risk for a spine-type injury, setting up prevention programs for avoiding back injuries, and building a relationship that can lead to also directed business-directed referrals at the time of an injury of one of their employees. We had a program where we were working with a construction employer who the employees carried cards in their wallet with a special toll-free number staffed by a 24-hour nurse and a physician to be able to manage patient injuries from this employer, because they felt, like many do today, and it's been demonstrated on outcome data, that if these patients were screened very early on in their injury process, they would be able to return to work sooner, have less interest in pursuing, legal measures against the employer for selection of a physician, and get them, returning to life qualitatively. So in the employer market, particularly the corporate self-insured market, is a very large opportunity for spine centers. And again, it starts with education and leads to then from there perhaps contracted business for referrals to the center, and building from there. The same applies to work-related injury. And then last but not least, the world of medical tourism and cash pay patients is a very, very important market to pursue. These patients may be coming from within the U.S. or outside. Starts with education. It starts with the services of your team. Social media and an internet presence is key to that, and educational programs, educating these groups about what your center offers, what are the rates that you can negotiate for services for both conservative care, diagnostics, and operative, non-operative, and how you relationship build with patient success stories to become a dominant source of good care for these groups. They're all looking for these types of venues.
Thank you, Mercy. Before I advance to my next question, you've already started. We got an attendee question. You've already somewhat addressed it. I want to see if you want to discuss this any further. Attendee wants to know about some specific strategies you would advise our attendees employ with health plans, with workers' comp, and employers to network the marketing program. I know you already offered a few. Wanted to see if you had any other thoughts in terms of specific strategies.
Well, I believe that, again, this all starts with communication, responsiveness, data, and access to information. So one of the initiatives that we highly recommend is quarterly, white papers and reports about outcomes from the center, and distributing them to the employers, third-party payers, the medical tourism groups, the consumers, so that you can adopt the presence of total transparency in not only the delivery of care, the approach, but the outcome. So quarterly white papers on what's going on at the center are very important. And sharing key data points about patient satisfaction and other variables and even cost of care that really impact these groups. The other thing I would be doing is having a quarterly research newsletter advising them on the various clinical trials or outcome studies or post-market studies that the center is involved with that may potentially be opportunities for their constituents or their members. Again, that information is very important. As I mentioned earlier, I would really look towards seeing either one of the surgical team or the MD team, as well as the nurse navigator, every quarter going to meet with a carrier and putting on a community or an educational event, even with nurse CEU credits if you can get them, and educate them about new advances in the field and how it impacts the care of patients. I would be talking about also the types of training that's required for using these new techniques or these modalities. For instance, robotics, what is it all about? Who needs to be trained? What's the learning curve? What should you, as a payer, be looking for in the payment of these claims as accepted or and necessary procedures? And the whole training process for what's required for a surgeon to be able to adopt this technology into the center and the practice. So those are some of the key initiatives that I would be looking towards for pursuing these.
Excellent. Thank you, Marcy. Okay, well, back to my next question. What actually makes a marketing plan successful?
Well, the success is in the numbers and the outcomes. Just like we want to get patient outcome data, we need to be able to measure the marketing plan. So it's key that we have a baseline, we have a budget, and we constantly track data and measure it against the objectives we set in the plan. How many patients did we see this quarter? What preferred payer mixes are we looking for? How did we measure up against that? Where did we fall short? Where did we regain perhaps cases that had out-migrated to another facility, but through the rebranding and the marketing of the services of the center, we were able to get them back and interested in talking to us and coming to our facility. So I would say the success of the marketing plan, what makes it successful, is several things. Creation of, obviously, new referrals, increasing revenues of the spine center, but also creating a brand, if you will, for the center as a destination center for spine. And that comes from being able to market patients, physicians, referral sources, employers, payers, all of these groups, and having them start to perceive the center as a place that people want to go to, that when they go there, they receive good care, that they get their reports timely, that they have communication with the physicians, that they don't just send a patient into a facility and never see them again. So all of these variables need to be tied into a tool that can be used to measure the success or the efficacy of your goals and objectives for your marketing plan.
Thank you. Final question I have for you, and then we'll get into a few more questions we have from attendees and any others we receive. Let's get into a little bit about what can cause a plan to, I don't want to say fail, but again, as I said, to struggle to not be as successful as a center or surgeons would like it to be.
Well, there's several things that over the years I've seen that have caused the plan to struggle. Number one, the plan can only be implemented successfully if they have consensus and buy-in from the whole team at the spine center, including the hospital, that this is the direction they want to go in. So there has to be communication and input in the preparation of this plan with the constituents and the team at the center, so that it becomes part of their culture, if you will. not doing that will create struggle, and it will create a lack of participation, because many times physicians will say, you know, I already have all the patients I need. Why I don't want to do marketing. Well, there's a difference between doing marketing just to generate patients and marketing that's tailored and customized and strategic. So, for instance, surgeons in particular, don't want to spend all day seeing 50 non-operative patients when really what they want is to identify and see those patients that require surgery. And so it's very important to be able to, with your marketing, create a triage process through the center that maximizes the best care for the patient, patient-centric, but also creates efficiency and puts the right patient at the right time with the right provider. So those components are very important to your marketing plan. The other the mistakes that can cause a plan to struggle I've seen is sometimes a reliance on heavy advertising, which without education, it does not generate the kinds of results, and it's extremely costly. So our philosophy is a broad-based campaign using the tools in the community and using advertising judiciously for perhaps research and patient recruitment for studies or some general awareness type events, but not building a whole plan around straight advertising, because it's just not going to be effective in generating the kinds of referrals that you want.
Well, that concludes the questions I have for Marcy, and now we're going to get to some more questions from attendees as a reminder. Actually, first, Marcy, thank you for addressing all of my questions and the attendee question I threw in there. As a reminder for our participants, if you want to submit questions, as some of you already have, you can do so by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. First question, Marcy, a general question, who needs to be involved in the marketing plan?
Well, I have to be honest with you. I mean, there'll be a core group that from the marketing department that writes it, but it needs to be a living document that starts with all the members of the team for the Spine Center and nursing, administration, clinical services, in producing and having input into this document. So the marketing liaison, if you will, or the marketing department of the hospital may be, or a consulting group may be facilitating all of this, but every person involved, every physician, every allied health provider, every clinical and non-clinical person that's involved in the center needs to have a voice and needs to have their input. And so we start out with that. We use the clinical operating committee and the multidisciplinary team as the first place to go gather data about what the plan should look like. And from there, we refine it and we build it. And when we get to a place where we've created the draft, we want to share it with everyone to make sure we have their buy-in. It's a great tool for consensus building and can only further the success of the plan.
Excellent. Next question. Do you have a suggestion for accurately gathering information on how patients come to a practice other than the receptionist gathering the information?
Well, there are many tools right now in the marketplace that allow a patient who's sitting in the waiting room to sit at a kiosk or use an iPad to be able to fill out, and not a lot of forms, but just some short survey forms that give us some great information on that, because we can't always rely on the actual receptionist in the waiting room being able to gather that data. The other very important way that we gather that data at our centers is through the intake coordinator and the use of our software system that we recommend, Priority Consult, in tracking all of this information at the time the patient calls, so that the intake coordinator is actually sitting at the computer and logged into the software and asking the patients a series of questions so that we can get that data. So patient waiting room, one great place, using an intake coordinator for all referrals and a patient triage and planning type software that allows you to be able to coordinate all the multidisciplinary facets of their care are some great ways to be able to capture this and not lose information.
Thank you, Marcy. I'm going to get into one last question. I want to give you a few minutes to share some final thoughts, and I think we will conclude. Marcy, you mentioned the concept of a travel program. This person wants to know, how do you organize, how do you build, how do you develop a travel program?
Well, it probably sounds a lot more difficult than it is, quite honestly, but it really starts with the whole philosophy of what we find in the hotel industry and adapting it to a practice-type situation. So you want to have, and it doesn't have to be a full-time person initially, but you need to have a dedicated contact in the center and in the spine center that will be the focus for patients who are interested in traveling from outside the area to come. And this person should have gone out into the community, probably with the hospital supporting them, gathering relationships with local hotels for discounted rates, local transportation services for discounted rates for to and from airports, gathering information from the local communities on events and various resources in the community while they're there. We've even had this person identify patients in the area around the spine center that have had the procedures and can act as sponsors, if you will, or support angels, if you will, while other families are coming in, new families are coming in for procedures to kind of help them through the process of people who've already been through it. But it's a dedicated person, part-time initially, building a program for the hotels they could stay, helping them with any airline issues. It's even possible if there were enough patients to go to a carrier like an American airline or a JetBlue or someone like that, and even see if you can get some discounted rates negotiated as part of your travel program, and creating a venue that welcomes them into the community and has a person who will be their concierge, their personal concierge while they're there, to help them with, you know, getting tickets to events that may be happening while they're there, getting them to and from, helping them get to and from their various office appointments. A lot of times hospitals will have a dedicated shuttle service, which patients love because they can never find parking, and then they're out of town and they may not necessarily know where to go. So it's the equivalent of that type of person who you would go to if you were in a hotel to help you get through your stay. That's the beginning of the most important part of the travel program.
Thank you, Marcy, for addressing close to a dozen or so questions. For those of you who submitted questions we didn't get to, I'll be passing them along to Marcy along with their contact information. And Marcy's contact information is on this final slide here, and I definitely encourage you, as I know she would, email her, call her, you can contact her certainly directly. I'm sure she would love to hear from you. Before we conclude, Marcy, I want to give you a chance to just share some final thoughts.
Oh, thank you, Rob. I appreciate the opportunity to speak with everyone today, and I think that the opportunities for Spine Center, even with all that we fear may negatively impact spine and healthcare reform, I think that what will actually come out of all of this is that the marketing of spine centers will be a key component in being able to manage all of the nuances that are coming along in the field relative to proving patient care, proving efficacy, proving patient satisfaction, and demonstrating that a collaborative, transparent model for patients that is completely patient-centric, if you will. So my thoughts are, think outside the box, look at your market, identify new markets that you may potentially want to look into, constantly advance your center through education to key groups, as I've outlined, and remember that this whole process begins and ends with the alignment of the team and the participation of all stakeholders, the hospitals, the physicians, the allied health providers, in a model of delivering quality, measurable care. That's key, and taking advantage of opportunities as they occur each day to look at what we're doing, why we're doing it, and how can we improve our services will only lead to more advancements for the center and its growth.
Well, excellent. Thank you, Marcy. And again, thank you again for taking the time to address all of those questions. I want to again reiterate and encourage our attendees to contact Marcy directly. You can also respond to any of the emails you've received about this program, including the one that I sent you this morning, reminding you about the program. If you have any additional questions, feedback, requests for topics for future webinars, we'll be continuing to do these programs going forward. Again, Marcy, thank you, and I certainly want to thank all of the attendees who took time out of their day to join us. With that, this concludes today's program, and I wish everyone a wonderful afternoon. Thank you.